to live a healthy life.
Yeah. Where does she get her information from? Do you watch TV
Your
with
children.
her?
And you're not wearing a mask at home. All of these things that we find in African Americans increase your susceptibility to getting the virus, especially this more contagious Delta virus. Right now, in hospitals throughout the country, but most certainly in the South.
What happens if it's positive? Some people do not want to take the risk.
You need to ask those questions.
What made you come?
I came because I want to get vaccinated so me and my family won't have COVID.
Hi, how are you today? This is a beautiful day in the ATL. I got blue skies, which I really like a lot. The weather's still nice, and I'm very happy about that. This is For Your Health. I am Dr. Lenore Coleman, president and founder of Healing Our Village and Total Lifestyle Change, and we are here in Clayton County at my new location, 177 North Main Street in Jonesboro, Georgia. Come on by. We're here Monday through Friday, and on Saturdays, this is where we are filming our show, For Your Health. And our number here is 800-788-0941. So what I need you to do right now, some of you have already gotten the notification that I'm streaming live on my Facebook, on YouTube, and on my website, HOVHealth.com. Take a minute right now and do a watch party. Send this out to all your Facebook and all your family and friends, because today we are having a COVID conversation, all right? I am doing this now every Saturday if I am able to find guests to be able to talk to you about what's going on with COVID, give you the latest information. Hey, listen, send me some questions. I have people here in the studio that can tell me your question. We can answer your question right now live. All right, all y'all are out here still thinking about taking the vaccine. I don't know what you're thinking about, but whatever you cogitating on, all right, we're here today to get you from thinking to doing. Because I need you to go get a vaccine today, not tomorrow, today. Today I need you to go get a vaccine, all right? So we are honored to have in studio today. I'm so excited about in studio. My two friends, I call them friends, but they're also colleagues. These are the doctors Peters. This is Dr. Terri Peters, this is Dr. Rick Peters, and they are here from the Baltimore, Maryland area. They came into the ATL this weekend for the game, all right? So they're football folks. And I know a lot of y'all out there going to the football game on Sunday. If you see them at the concession line, I want you to say hi. Say hi, y'all. I saw you on Facebook, because we need you to be able to understand that this COVID-19 is no joke. That over 600,000 people are no longer here today that were here last year, okay? So people don't seem to understand that folks are dying. In fact, we got 1,500 people a day still dying because of this new variant, the Delta variant that has popped up. And the folks that are dying now are the 25% of the country here or there that won't take the vaccine for a whole bunch of reasons. Okay, so we're here and honored to have two specialty pharmacists, but they're also hospital pharmacists, to let you know what's really going on in the hospital, because y'all seeing this stuff on the news and you thinking that somebody talking to you through a respirator is a ventilator, and that's not a ventilator, people. You're not talking, you're on a ventilator. So anybody you see on TV talking, they're on respirator, all right? And I want you to understand the seriousness of this problem. I also want you to understand about Regeneron. All this stuff going on, talking about Regeneron is the lifesaver. And so I can just go ahead and get COVID, and it's cool because I can just go get me some monoclonal antibodies and I'll be fine. Okay, so I got some folks here to tell you that that's not true. Not from what they read or what they heard, but from what they are seeing every day, because they in the trenches working in these hospitals and have been working in the hospital since last year, okay? So welcome, guys. Thank you so much for being here today. We're going to start with having Rick, Dr. Peters, tell us a little bit about who you guys are, what you do, so that the audience understand that this is serious business. We got some show enough experts here today.
All right. Good afternoon. And again, my name is Rick Peters, pharmacist, and I am the Vice President and of Quality of Life Pharmacy and Health, co-owned with my wife here, Terri Peters. I'm also a hospital pharmacist, working in Maryland as well. And I am past board member of the Maryland Board of Pharmacy and past MPHA Board of Directors. And so we're here today to talk to you about COVID in our community.
All right, Terri, please say something. We need you.
Hi, my name is Terri Peters, and I am the President and CEO of Quality of Life Pharmacy and Health Incorporated. I'm also a member of the National Coalition of 100 Black Women, Prince George's Chapter, a member of the Prince George's County Health Commission, and we are very adamant about ensuring that people understand COVID and the consequences of COVID. It's not a cold, it's not the flu, it's something even more insidious and dangerous. And the damage that's done because of COVID is a lifetime change. So as we continue to talk more about it, we'll get more into other details of some of the testing and the lab work that's involved with maintaining or trying to get people to survive this deadly disease.
Yeah. So what I want you all to get from that little introduction is these folks are certified and qualified. If you didn't know what NPHA is, that stands for the National Pharmaceutical Association. These are Black pharmacists that have been, this organization is not new. It didn't just start. We've been around. I was at the very first meeting back in my 20s and when I was in pharmacy school. And by the way, people, I'm 68 years old. Okay, so this organization has been around my entire pharmacist lifetime, all right? And we are out here trying to make a difference in our African-American communities. And so, you know, when you see an African-American pharmacist, say, hey, are you an NPHA member? Because if they're not, they need to be, okay? Because tell them NPHA is doing good things, big things. But I want to, Terri, listen, you and I talk on the phone like, 2 or 3 times a week. Tell me, what have you heard in terms of 2 or 3 of the most craziest things you've heard about COVID-19? I just want you to get the myths and the misconception, the misinformation that's out there.
Some of the crazy things that I have heard people say about the vaccine. One of them is that COVID-19 causes small blood clots in the capillaries that can lead to heart damage. So when I heard this, I went into teacher mode and I said, blood clots are caused by diabetes, hypertension, cancer, high cholesterol. And COVID causes very large blood clots, so much so that testing is done immediately when the patients come into the hospital with COVID of a marker called D-dimer to see your clotting risk, and the patients are immediately put on anticoagulation therapy, either Lovenox or heparin, depending on how well their kidneys are functioning. So there's more to this than just, these microclots. No, COVID causes large clots that can lead to a stroke, pulmonary embolism, heart attack, and liver failure, and kidney damage. Those are the clots that you see with COVID, which are much worse than small clots in the capillaries. So that was the first myth buster I had.
So the vaccine does not cause that, folks. You're hearing all sorts of stuff about this vaccine's got magnets. I've heard the people say that they're tracking us and tracing us with this marker that's in the vaccine. Okay, so can I just say for people, y'all got cell phones. Okay, so if you think that you not being tracked or traced, they can do it real easily with your cell phone. Number 2, can I just say, I don't know if you watch the news. I watch the news like every day. I'm a news junkie. Did you all hear about the 4 people that put the guns and the stuff in the car in Afghanistan? And before they left their driveway, the drone came over there and killed them? Okay, that was in Afghanistan. If somebody trying to track you, trust me, they don't have to give you no vaccine to be able to do that. Okay, so that's crazy talk. Please, you heard there in my village. I'm trying to heal this village.
You know, I think the worst thing is for me is the talk from our people in our community that they're listening to people that we look up to that are not healthcare professionals,
Right.
such as comedians, even rappers that say things like, well, you know, masks don't work. You know what I mean? Eddie Griffin said, you know, y'all are going to, like sheep to slaughter, going to get the vaccination. A sports star was on TV and said that that the interviewer asked him, well, when are you going to show some concern towards taking the vaccine? And he said, when I get COVID. Not understanding that you just said on national TV that you are going to get serious about taking a vaccine, which is there to help prevent you from getting COVID. It's not a treatment.
No.
So when you get COVID, you can't get the vaccine. So I think that's one of the biggest things that bothers me out here is that we're listening to people that don't have any science behind what they're saying. They don't have any education behind what they're saying. And yes, they are great in what they do, but that's where their expertise is.
Yeah.
Their expertise is in what they do.
Exactly.
You need to listen to the people who have expertise in the healthcare field related to this.
Yeah. So we're talking about, I've been in practice for 40 years. And this is the first time in my lifetime that people are not listening to medical professionals. I don't get that. They're not listening to their doctor. They're not listening to their doctor. They're not listening to their doctor, their pharmacist. They're not listening to any medical professionals. They're listening to people who probably didn't even pass biology in high school, okay? They don't know no ologies. When I was in pharmacy school, I had to take all these ologies. I had to take pathology. I had to take biology. I had to take physiology. I had to take all the ologies. And I didn't take immunology and, virology. Those are what you need to be talking to people who took those things because they know about viruses. Okay, I'm not an infectious disease pharmacist. I do diabetes, folks. All right, but I am really focused on the fact that my folks with diabetes, uncontrolled diabetes, are dying from the bad effects of COVID. If you look at the data from last year, who died of COVID, it was people that had out of control diabetes, out of control hypertension, and obesity. Now, let's just talk about in this country, that we got 66% of people that are overweight and 33% or more people obese in the United States of America. So there's a whole bunch of people who are obese, all right? And if you don't believe that, I just want you to go to Walmart, all right, and just look around at the folks that are in Walmart. Because I always go to Walmart when I kind of want to figure out what's going on with my village, right? I go to Walmart, I go to the grocery stores, I go to Sam's Club, I go to all these places because there's a lot of people there. And I look and see what these people look like. And a lot of folks, okay, are not just overweight, but they're 100 pounds, 200 pounds overweight, all right? So those people were at increased risk of getting this COVID. Now, is that not what you saw in the hospital, right?
I saw a 31-year-old young woman who weighed almost over 300 pounds, and I watched her deteriorate until she finally passed away. And this, unfortunately, became the norm. We started looking at the ages, 30s, 20s, 40s. It was very, very, very depressing to have to work on it. At a certain point, I would find myself yelling at the televisions, please stop. Every time there's a holiday and people are not wearing masks and refusing to be vaccinated, I know that we're going to have a sudden surge, which means I'm going to be working around the clock, working with my staff, because it's a hospital, it's a 24-hour operation. People have to take care of these people who are coming in with these illnesses. And it's not just COVID, it's COVID along with diabetes, hypertension, high cholesterol. So they're already at risk of forming these clots that everybody's talking about that COVID vaccine causes. It does not cause that. Their underlying disease state causes the clotting, and then COVID goes after the weakness in your body to make it even more exaggerated.
Yeah, exactly. So younger people, Rick, go chime in.
I wanted to add to what you said earlier. because a lot of my work is on vaccine hesitancy in our Black community. I've talked to a lot of churches, community organizations, and even at the hospital. When the vaccine first came out, it wasn't mandatory at the hospital, but the majority of the hospital employees took the vaccine, and the 50% that were unvaccinated were mostly the African Americans that worked at the hospital. So I was asked to speak to them as well, being pharmacists there at the hospital. But I want to go back a little bit to what you said earlier about all the ologies we took. And to explain just in reference to vaccine hesitancy, when they're talking about this technology, messenger RNA is in our biology. You know what I mean?
Yes.
You know, they're taking advantage of something that our body already does.
Yes.
Messenger RNA is in the process for protein synthesis. So they're actually using our own body to help promote our ability to fight off a disease. So there is this messenger RNA. You know, this is not something that they created somewhere, you know, in a lab. It's something that already works inside of our body. So, and we all took all our biology, so we know that just from biology. You don't have to be an infectious disease person to understand that.
Right. Meiosis, mitosis, that was when your RNA and your DNA were developing who you are as a human being.
Exactly. And you're worried about us taking a vaccine to actually promote something our body normally does, when I know that all of my sports players, football players, basketball players, and weightlifters sit there and take vitamins and protein and DNA bodybuilding precursors, whatever, which are not approved by the FDA.
No.
And like all vitamins, they have to put a tagline on there to say that this vitamin or this supplement or whatever is not approved by the FDA. It hasn't been evaluated by the FDA.
Exactly.
And you cannot have any claims towards what it can and cannot do. But you guys are out there taking those like crazy, bodybuilding, getting huge muscles, larger than the body's supposed to have. You know what I'm saying? And
Yeah, I know.
selling our non-bodybuilder people out there selling Herbalife, right? And that's one of the biggest network marketing programs out there. And they're pushing up. And if you go turn your bottle around, your Herbalife bottle, when you order it, or when you have those conventions and you tell everybody to take it for their cholesterol, their diabetes, you know what I mean? It'll show on there. It actually says on there, if you have diabetes or any of these issues, consult
Your
right?
doctor.
Your doctor, your pharmacist, before you take it, because it's not FDA approved. So to sit there and say that you don't want to take something that was evaluated by an early release means that they evaluated it. They just decided to release it a little earlier than the normal long time that they normally take to decide to approve something, because they saw what? The benefit versus the risk. This is not the first time they did that.
Right.
When the AIDS crisis was here and the gay population was fighting for something to help them.
Yes.
What did they do? They marched on Capitol Hill or whatever until they pressured the FDA to do the same thing.
Right.
Exactly.
We have something out there that's finally showing some activity towards helping to stop, slow down, or cure this virus. Can we get an early release?
Exactly.
So this is nothing new.
It's nothing
And now
new.
they're saying, even with the HIV medications, some of those medications that are coming out now are not only preventative, but are curative
Right.
because of that fight by the LGBTQ family members.
Yep.
Okay?
Exactly.
So
Exactly.
their fight has saved their lives. And we need to fight COVID. Dr.
saved our
Fauci is
lives.
not the enemy.
No, he's not. No.
COVID is the enemy.
COVID
and
is-
that's who we need to be focused on fighting.
Yeah. Yeah. So you raise a good point. When I talk to people, because I'm out here just like you in the trenches. Every time I say, here I go. Did you take the vaccine? No, I haven't. Why not? And we have to have a COVID conversation because I need to understand what you're saying, right? Okay. So this is the interesting thing I'm talking about African Americans, because that's who I mostly deal with. Okay, that's who's in my family. That's who most of my colleagues and friends and church members, employees, etc. So black folks, I call them black folks.
Mhm.
Black folks put a whole bunch of stuff in their body. Now you just talked about these vitamins and all these folks out here, right? Vitamins is $1 billion industry.
Yeah.
You don't get to become $1 billion industry unless a whole whole bunch of folks taking it, okay? And on the bottle it says, no claims can be made for this.
Right.
Let me tell you something else black folks is putting in their body. You talking about your athletes? Well, how many of them are taking them steroid injections? Right? Anabolic steroids. Get them big muscles you say that the body's not able to handle, they take them. Okay? How many brothers out there have a little pain on urination, think they might have STD, go see the doctor. Doctor says you got gonorrhea, syphilis. You don't say, well, doc, before you give me that penicillin shot, I'd like to know see the clinical data on that shot. How do I know that what's in that needle is really penicillin? You might be giving me anything. I don't think y'all have that conversation, right? No, you saying hurry up and give me that bicillin shot, right? Okay, now, we raw here. We raw for your health. Let me talk about all y'all buying a little dime, nickel, 50-cent bag on the street of marijuana that you are inhaling. You want to get the fastest way to get a drug in your body, pharmacist?
Inhale it.
Inhalation, and you're inhaling this thing that you done bought from whoever, Pookie on the street. Pookie done sold. Okay, Pookie ain't got no white coat on. You see my white coat, people? Okay, Pookie ain't got no white coat on. Pookie selling you this stuff. He ain't told you what's in this stuff. But you take that stuff, you roll it, and then you inhale it, and you ain't said where's the FDA study that's telling me about what's going on with this bag. Okay, so I told my friends, colleagues, just before we started, I don't care what side of the street you're gonna walk on. You can walk on the right side of the street, I'm not gonna take no vaccine, or you can walk on the left side of the street, I'm gonna take the vaccine, but whatever side of the street you're gonna walk on, you got to stay on that side of the street. You can't say that I'm gonna take this bicillin shot, but I don't want to take COVID shot.
Right.
Okay? Okay, because it takes a long time for gonorrhea and syphilis to kill you. Am I?
Right.
I'm just saying.
The study.
Not COVID.
They used that as the reason initially.
Okay.
The syphilis study.
Yeah.
As a justification for not getting the vaccination.
Well, let's talk about that. There's a book out, because I understand that in our community. There's a book out called Medical Apartheid. The book is this thick on the things that have happened to us over the years. I think the worst thing was when I read the book and I saw that when I was in college, I was at the doorstep of part of one of the atrocities that were being done, which is the government-sanctioned, or city-sanctioned use of Norplant, enforcing it on welfare women. Right? He's talking about reproductive rights. We're talking about reproductive rights now, right? Being taken away. Where these people's productive rights were taken away by saying if you're going to be on COVID, you must be on this Norplant, which they eventually had to take off the market because of the issues
Because of all the issues. But
Exactly.
that was a way to sterilize all the women that were on Medicaid and welfare. Yes.
Exactly. So I understand that we have our Tuskegees and we have our Norplant situations. We have our Henrietta Lacks. We have some things that that will put us at least a question mark.
Right, I get it.
But you still have to look at the overall picture of the science. This is public health.
Yes.
Right? And if the government didn't do nothing, you'd be the first one in line hollering and screaming about, government don't care about us, don't do nothing, let us die out here. So they're doing something. And let me give you a quick scenario. Walking in the hospital, I worked the other day, a doctor stopped me and we're talking in the hallway. And right behind her head, I never noticed it because it's History Hall way, there was a picture of my hospital helping people during the 1920 pandemic. And I was like, wow, so this hospital was over 100 years old and it was there during the pandemic of the early 1900s. And I'm saying to myself, I wonder, did they have a vaccine back then?
Mm-hmm.
So I came on that night, I researched it and found out the blessing that we have now was not available then. They were scratching, trying to find, polio vaccine had just came out. They had just finished dealing with trying to eradicate polio. You know what I mean? They had scientists out there that were actually doing studies and trying to figure out virology at that time. And the problem during that pandemic is they were not actually clear on whether the Spanish flu was bacterial or viral.
Okay.
So that delayed the whole process. And they actually didn't even figure out a vaccine until the 1930s.
Right.
So 10 years have passed.
Yes.
All right. So you expect us now, 100 years later, all the technology and the science, we're the greatest country in the world,
Right.
and you think that we shouldn't have improved science in 100 years?
Come on.
And we get the improved science?
Yeah.
And you're going to sit there and say, well, I'm not going to take it because I need more research.
Right.
Well,
It came too fast. How'd they get it so fast?
exactly.
I'm sorry, you're in a position to tell somebody how fast something's supposed to come.
Well, they were
Right.
already working on it. That's the whole
Jesus.
point.
Well, but
That's
that's
why
not
we didn't know what Ebola.
You get phones before you finish paying a couple of payments on your phone. They got a new version of it.
Yeah.
That's
Okay?
how advanced.
That's how advanced we are in technology. We're not just advanced in cell phones. We're advanced in science too.
Yeah.
So yes, what they took them 10 years to figure out in the early 1900s, we figured it out in 10 months.
Right.
Exactly, and that's
But
phenomenal.
because it's phenomenal, because we also have evolved and been working. We're pre-planning. Obama had things going on during his term, studying this and handed over information to the next president
Yes, he did.
about this is what's coming and this is what we've been doing. So they were even during Obama's administration already looking at how can we continue to practice in a way medically to avoid pandemics or be ready when it comes. So it's not nothing that you just came and turned into in 5 seconds and put in a vial and said, let's inject this in all the people.
Exactly.
So we have a blessing here based on 100 years of technology that they didn't have, 100 years ago.
Exactly.
And you're going to question that. And listen to the
People that haven't
comedian.
got a clue.
They got no science whatsoever, but we got 100 years of science
to
put
back
us-
what we're
to
saying.
back what we're saying.
Exactly.
Yeah. And you said the word blessing, and you guys know I love Jesus, and I'm all about the whole spiritual thing. Last week when we were having a COVID conversation, I told the folks that for all you Christians out there that waiting for Jesus to heal you, you heard the joke about the man where they sent all the helicopter and the boat and the airplane, and they died anyway, and then he got up to heaven and said, Lord, how come you didn't help me? He said, well, I done sent. Okay, the helicopter, the boat, and the airplane. You didn't want to get it. So, but let me just tell you this: for you Bible reading Christians out there, you need to look at how Jesus healed the blind man. He healed blind people 3 different times in the Bible. One of the times he used some spit, put it on dirt, made pieces of dirt and patties, and put it in that man's eyes. Then he told that man to go to a specific body of water to wash it off. Okay, that's what this vaccine is. This is a blessing. It's a blessing. Right? Sometimes he does this. But there are some folks that are not willing to take the blessing, all right, that is being given to you. And so, you know what? Shame on you. Because this is a life and death decision. You are playing roulette, and you're not winning no money. At least when you go to Vegas, you can make some money on the roulette table. Maybe you might hit your number. Okay, but this is not the way to hit your number, folks, because the number, if you hit the COVID-19 number, okay, it's going to possibly take you out of here. Terry, you were talking about ventilation, the ventilators, the difference between that and being on respirators, and that people don't understand. Tell them about this 4-drug cocktail and what happens when you're put on a ventilator.
Well, first of all, being put on a ventilator is a surgical procedure. You need to understand that. They actually access through either directly through your throat or down through your esophagus equipment that they have to paralyze you for. And when you are given these paralytics to paralyze you, basically you're put in a death state. Because if you are not put in that state, the automatic response of your body is to try to yank it out. You do that, you'll rip your esophagus wide open and you could bleed out. And you literally could drown in your own body fluids. So you have to literally be surgically prepared to receive that piece of equipment into your throat. So they put you on paralytics and they keep you on paralytics. So you're in a paralyzed state. Then to control your pain, you're receiving fentanyl drips. Then to keep your muscles relaxed, you're receiving midazolam drips. And then when your adrenals start to fail, your adrenals are these little pyramid glands that sit on top of your kidneys. Basically, I call them your battery packs. When they go, basically you're done. There's a cocktail that most people end up on that contains either norepinephrine, vasopressin, epinephrine, and phenylephrine. We call these the death drugs because when your adrenals stop working, you pretty much have to go on those drugs to keep your heart beating, to keep your blood flowing, because everything's paralyzed. It is not a pretty sight. And if you want to get into the worst part about it is people die alone because family members cannot visit you. Family members cannot call you. A little shout out to one of my dear friends. She started My Condolences to help people to be able to do a Zoom visit to the people who are in the hospital who are dying, because it is the most saddest death you could imagine, because no one can hug you, touch you, kiss you, and you are put in this death state so that they can breathe for you. So that's intubation. That's not the respirator. That's intubation. So when you hear us talk about intubation, you are literally put into a death state, and this machine is breathing for you. That is not the way to go. And that's too often what you're gambling with when you choose to get COVID.
This medical moment is brought to you by Total Lifestyle Change. Should I get the COVID-19 vaccine? The answer is yes, you should. Over 600,000 people in the United States have died of COVID-19 since 2020. This is not a myth. This number is for real. If you're an African American with diabetes, heart disease, obesity, or other conditions that affect the immune system, you're at a much greater risk of suffering the bad effects of COVID-19. The Delta variant is here in Georgia. Only 38% of the people in Georgia have been vaccinated. This needs to be 80%. The Delta variant is more contagious. Most of the hospitalizations we're seeing now are in unvaccinated people. You're in control of your destiny. You can protect your family and friends by getting the vaccine. For more information on where to get your free vaccination, go to vaccines.gov. If you have any questions about the safety of the vaccine, call Total Lifestyle Change at 800-788-0941. This medical moment has been brought to you by Total Lifestyle Change. For more information about COVID-19 and other chronic conditions, visit us at tlc-global.org. Remember, knowledge is power.
Exactly. So when you see on the news folks talking to you through the respirator, okay, that's not what she's talking about. Okay, that's totally different, right? That's just oxygen they're putting in there to bring up your oxygen levels, okay? And those people, if you don't notice when you see them, they're not doing okay, right? They're not playing bid whist and dominoes out in the park, eating some barbecue. No, that's not what they're doing. These people are struggling and fighting for their life, and some of them don't win the fight. All right, so why do that when you can just go get a vaccination? I don't understand.
Get a vaccination, wear a mask, cover your nose and your mouth. Not because one thing that is not talked about much is your nose is filthy. There's a lot of nasty things in your sinuses. Why do you think they use the testing for COVID? They use your nostrils because a lot of nasty things are growing in there. MRSA, which is a staph infection that's resistant to methicillin. So that's how powerful that bacteria is. You have viruses, you have fungi, you have all kinds of nastiness that gets trapped in your sinus cavity, and COVID uses that route to get into your lungs and take over your lung function and annihilate your lungs. Understand that. Cover your nose, cover your mouth. We're all vaccinated here. That's the only reason why we can even safely sit next to each other is because we're vaccinated. But the nose is filthy. Cover your nose. So if you're not going to get vaccinated, you shouldn't be walking around without a mask because, to be honest with you, because we work in a hospital, we're more dangerous to you than you are to us. Because we may be harboring some of that in our sinus cavity. One cough, I can take out a whole store. One sneeze, I can take out a whole store. So you need to understand that. The mask is not just to irritate you, it's to protect you. So just keep that in mind.
Especially if you're in crowded places, right?
Especially in crowded places.
Yeah. So you actually said you had some family folks that had gone through some of this, right? in terms of just COVID and not wanting to get vaccinated. And then, I mean, you know, this is personal to us,
Right. Yeah.
right? I have
Church
people who
members,
work for
family
me, church members, people, their staff. They lost loved ones last year. I know this is not a myth, people. She's here working every day. How many of your employees had to either be sent home or quarantined or actually died over the last, you know,
We actually had
18
one of
months?
our emergency room nurses, not sure how he died, but you know, we wondered that's what he died from. Actually they had to shut down a whole unit in one of the hospitals because everybody who worked in that one area, they passed COVID around. And there were some nurses, they did the same thing because they were all having lunch together. And one had COVID and everybody got it. And it dramatically impacted the workflow.
Yeah.
So it's not something that you want to take lightly.
Yeah, you said, I remember talking to you, and you said just when we were talking today that your numbers had dropped. Finally, had
6
dropped.
patients, this just in June. And we let a bunch of people go because there was not enough volume to keep, there was not enough volume of patients in the hospital to justify the number of staff that we had.
Explain it as the all COVID hospital.
And one of the things you need to know is that I work at an all COVID hospital. January 2019 to October 2019, we downsized from a full service hospital to a freestanding medical facility in October 2019. By by March 2020, we became a full service operational hospital mandated by the governor. Just for COVID. So we service nothing but COVID patients and maybe smaller units for 48-hour observation units in the emergency room. Our emergency room, 2 or 3 people before were coming through. We're like, sure, I mean, it's barely even operable because there's so few people coming through. Now we have 45 to 50, 65 people coming through our emergency room with COVID.
And are they vaccinated?
A lot of them were not vaccinated. Many of them were not vaccinated. They were still trying to make up their mind what, you know, they still want to see the studies. Okay, well, you keep looking at the studies and you won't be looking at anything when that tube is down your throat and you're in a paralyzed state.
That's right.
Yeah, so it's nothing to play with.
Yeah, I wanted you to talk a little bit about Regeneron, right? Because you all know a lot of information about that. And now that's some of our governors are making that to be sort of the plan A. Instead of taking the vaccine, which should be the plan A, they're making those Regeneron pop-ups, right? You've heard about that in certain.
Well, the most important thing the reason why they have to push the monoclonal antibody Regeneron is because people refuse to get the vaccine and because they're getting it. The key is, and just understand, even the remdesivir that they're using to treat the patients that are in the hospital that have the virus, the purpose of the Regeneron is to keep people from getting so severely ill that they have to be hospitalized and intubated. The goal is to avoid intubation at all costs. You can get somebody to breathe and keep the oxygenation close to 100%, then you're doing well. Because once that breathing goes down to less than 90%, your survival rate dramatically reduces. And I know.
And the first window to reduce all that is to take the vaccine.
The vaccine will stop all of that.
This is a secondary.
This is a
to hopefully
secondary.
help you.
Right.
If
you get there in
COVID.
time.
Exactly.
Right. Because
Exactly.
there's a window limit.
There's a window because
well.
Exactly, and there's a very small window because after 10 days you won't get Regeneron because guess what? You'll be in a hospital getting remdesivir, you'll be getting Lovenox, you'll be getting the death drugs that we call them. Well, you'll be getting all of that. You may or may not survive, and then the long haulers condition that you end up with is even worse because your whole quality of life is totally dramatically changed. Not being able to breathe because of all the scar tissue created by the intubation, because you're going to have some scar tissue in your esophagus from having that tubing down in your throat. You're going to have scar tissue in your lungs because COVID attacked your lungs. You may have scar tissue anywhere in your body where COVID went. In your brain, they have found post-mortem COVID in people's brains doing damage, looking like Alzheimer's or Parkinson's disease. Bell's palsy, when the jaw starts to drop on one side, it looks like you actually had a stroke because of the damage that's being done. This is real, and all you have to do is do a vaccination. A vaccination that takes a few minutes, few seconds, We even came up with a supplement to support boosting your immune system so that you can keep your immune system strong. And even though I've been vaccinated, even though I wear a mask and a head and a shield sometimes, I still take those supplements just to keep my cells healthy.
Right.
And so if you have a poor diet already and you get sick, now you're nutritionally deficient, and then you get COVID on top of that, which exaggerates your deficiencies. Really, COVID it is truly a predator. It is the invisible predator that's seeking whom it may devour, literally. And that's what happens that's what we see in the hospital setting.
Yeah.
So it's so important. Get the vaccination. If you choose not to get the vaccination, at least put a mask on to protect yourself.
Yeah.
And if you don't wear your mask, wash those hands, wear the mask, protect you. COVID gets in the eyes as well, and you can end up with pink eye. It looks like horrible blood red pink eye. COVID can enter through your eyes. It can enter through your nose. It can enter through your mouth. So many ways it's gaining access. And because of these people are not protecting themselves and wearing masks, it's mutating. There's a mu variant now. First, it was a lambda. So there's a delta, there's a lambda, and there's a mu. And I've just found out from my daughter, who's been doing researching and following this, 49 states now have the mu variant. And it's just getting stronger and more potent. More potent. It's attacking our babies now. So really protect I got the flu vaccine after my husband got the flu vaccine because he got it to protect our daughter.
Right, exactly. I want to talk a little bit about I've talked to so many African American men, young, so they're in their 20s, like 21 to 35, that age group, right? I mean, they're fit, they work out, they play basketball, they're thin, they're just healthy, super healthy. And I say, you take a vaccine? No, I didn't get it last year, and I got a great immune system, and so I don't need to take it. Well, let me just explain to you about something she mentioned. This virus is getting in your body changing. Viruses live. Viruses want to live. They will do everything they can to survive. So what they're doing is getting into the bodies of these healthy people throughout the country who have great immune systems, and they're trying to figure out how you slipped through the cracks. They're trying to figure your immune system out, and they're changing, and it's morphing, and then it goes back out into the environment so it can attack me. Okay, I'm 68 years old. I'm not 25 years old. Okay? So you guys are out here being a virus incubator. That's what I call you all. Y'all saw Alien. Y'all saw Alien, except for this thing ain't coming out through your chest. Okay? It's coming out through your mouth. It's coming out through your nose. You are spreading this thing. It is airborne. It is invisible. Okay, this is a science fiction movie, people.
Come to life.
Come to life.
Yes, it is.
All right? And it is in your body, all you young, I don't need to take a vaccine people, and you are there for helping it survive.
Yep.
I needed you to stop that. Stop that. Okay? And if you don't believe what I'm saying to you, look it up. It says it clearly anywhere you look. That's what viruses do, is they mutate. Now, sometimes they mutate to not being as bad, and sometimes they mutate to being bad. So let's stop the spread of this thing. No more variants. Let's stop, please, okay? All you got to do is just take a vaccination.
Someone
there's
describe
plenty of people who have good immune systems, all right, that are still getting it.
Yes.
And still dying for it. There are some sports players that have done some interviews where they said this is the worst cold, flu, whatever I've ever had. You know what I mean? And then when I got back on the basketball, I could barely run up and down, lots of things. So the purpose of the vaccine, let me explain that. The purpose of a vaccine. First of all, the vaccine is a drug based on the codes from the FDA. But the difference between a medication and a vaccine is a medication is used to treat disease, and it's approved to treat disease. The vaccine is there to, and is approved to try to help prevent you from getting disease. It's not a treatment. It's only there to try to help prevent. How does it help prevent? By giving your body some recognition, right? We send the vaccine in, it gives a little mirror image, a DNA image, chemical image to your immune system, so that the next time that your immune system sees it or encounters it, is already ready. I've seen this before.
And launched the defense.
Right. So you can have a good immune system, but if your body's never seen this before, you may survive. It doesn't mean you're not going to be sick for 44 days.
Right.
Exactly.
You know what I mean? And you may not die. And you may die. But the vaccine is helping your strong or weak immune system recognize this intruder. Because that's what your immune system's job is, to recognize intruders and to attack them, to try to stop them, whatever. But also the process of your immune system having to be activated also has a negative side effect because it can cause inflammation. And that's what it's trying to protect you. But that over-inflammation can also hurt you. Right. So if you want your system to be activated as short as possible.
Right.
If you don't have the vaccine, you have a good immune system. It hasn't recognized this thing. It's going to fight it. It may take 44, 50 days, and that's where you can get that extra damage from your system being activated for so long. But if you've had the vaccines, I've seen this before, it can probably help eradicate it in 2 weeks, 10 days versus 44, 50 days.
Exactly.
Less amount of information that you're going to be left with on the back end. So, we have to look at the whole picture. And again, this is biology and science. This is why you talk to us and not talk to your rappers or not talk to listen to your, hey, I love them all.
Your cousin.
Your cousin, you know what I mean? And the research is there. Y'all got Google phones. You Google everything else. Everything that we're saying, you can Google. We had to study it from the book, but you can Google everything we just said, and it'll tell you that. You can't Google anything that these other non-scientists have said, and you get the truth.
Exactly.
You know what I mean?
Exactly.
Sorry, Busta Rhymes.
All right, I love you. And your music is fine. Stay in your lane. Listen, I want to talk about schools. We got the kids. We got a vaccine that's approved from down to 12 to 18 now, right? So that we've done the studies and now it's emergency use for those kids. All the kids younger than that, they're working on that. And folks, I hate for you folks with the toddlers, but it's gonna take a minute because they do not bring a drug on the market for pediatrics for children that young without making sure that they're double checking and triple checking before they're gonna bring that vaccine out. So it's gonna be a minute. So if you're thinking it's coming real soon, that's not gonna happen. All right. So, but you got your 12 to 18-year-olds, right? And that could do it. And so, what's going on with schools up in your area? Are they open, closed? What's happening? Because it changes every minute, right?
Yeah. As soon as they open many schools, immediately children were getting infected. So many of the schools shut down because of it and went back to virtual learning because of it.
Right.
I think about if we homeschooled our daughter, and I was an avid anti-vaccination person. I really was. To be honest with you, I took a while before I even got the COVID vaccination.
I remember.
And I remember thinking at a certain point, I can't play with this.
No.
This is a new disease that we've never heard of, and they have a vaccination. All right, I'm going to suck it up. I mean, of course, I made sure I took all my supplements.
Yeah.
I made sure I took my little zinc test, and this is very simple. If you want to know where your immune system is, it's a cheap and inexpensive way to test it. Go get some Coldies gummies. Put it in your mouth. If it tastes horribly bitter, that means your immune system is functioning well, but you still should protect yourself. If it tastes like candy, you are high risk for getting infection. Very simple test. You don't even have to go to a doctor to do that zinc test. And we keep a bottle of those Coldies, Zicam, or they also have it. We keep it handy, and every week I'll pop one of them out. Okay, how am I doing? And I use that to guide me on how much more I need to protect myself.
All right.
And that's a very simple test. You can do that with your kids, and have them take it. Does it taste nasty and make the kid spit it out? His immune system's intact. But those children who more than likely got that were probably nutritionally deficient.
Yep.
Weren't getting enough nutrition. Their immune systems were weak, and they went to school, they got COVID, and it spread like wildfire. What you all don't know is that there were many children in the hospital already. They just didn't talk about it like they are now. But unfortunately, COVID has become politicized, and not treat it as the public health problem that it truly is. And we need to get away from this political aspect of COVID and start dealing with the public health issue. Like tuberculosis was a public health issue.
Right.
You used to go to jail if you spit.
Yeah.
Because tuberculosis had people in these sanatoriums because it was spreading so quickly.
Yeah.
And you're starting to see resurgence of those types of diseases because of this.
There have been court cases about people with knowing they had HIV and spreading it.
Mhm.
Yeah, no. This thing is serious. I see this thing as the same thing. You are not protecting yourself, and you are spreading something that is scientifically sound that can happen, and yet you're doing it knowingly, and then you're not even testing yourself. Listen, I got it. I'm not going to take the vaccine. Well, then you need to test every other day. Just test every other day. So then you know you're negative. So then you know you're not affecting anybody. Right? So if you're going to say, hey, doc, I'm testing every other day, so I know I'm clean. I don't have no COVID.
And wear your mask.
I wear a mask.
Saying that masks don't work. We're compounders, and we have to wear our mask every time we compound to keep the chemicals and the biohazards from us breathing them in. Surgeons have been wearing masks for years. Right? To keep from not only to protect them, but also protect the patient so they don't pass anything on. So we've been wearing these masks for years. You're going to tell me that a surgeon can't breathe? He does 13 surgeries a day.
Right.
He's wearing a mask for 10, 12 hours a day.
Exactly.
If he couldn't breathe, he would fall out doing surgery.
Right.
So the concept that they don't, so if you're not going to get vaccine, wear your mask. We shut down last year flu. Because everybody was wearing
you know you didn't get the flu this year? You didn't even catch a cold this year. Think about it. You didn't even catch a cold.
Because you were wearing masks.
Because you were wearing masks.
And all, I remember I said the vaccine is a drug. All drugs have side effects.
Right.
And all things have side effects. Your breast implants has side effects.
Okay.
Your booty injections have side effects.
We're
Right?
talking about booty injections.
Everything can possibly have a side effect.
The weaves, people have died from the glue that they use to glue somebody else's hair into their scalp. I am making compounds for women to help restore hair loss because they have alopecia so badly from the weaves that they've worn that have literally ripped all their hair out of the back of their head.
Right.
And I actually make compounds that will bring hair follicles back. So, I mean, really?
We taking risk every day with the things that we do. For instance, McDonald's French fries. I'm sorry. But if you check and you Google this yourself, McDonald's French fries is versus America versus Europe. Right? In America, McDonald's French fries has about 12 to 13 ingredients. In Europe, they can't even produce their brand the same way in Europe. In the UK, it only has 4 ingredients because they don't allow some of the chemicals that are involved. People are lining up at the Chick-fil-A, right? Talking about lambs going to slaughter. McDonald's and Chick-fil-A both have MSG, right? High levels of TBHQ, which is tertiary butyl hydroquinone, right? And hydroquinone, that's what, it's a chemical entity close to hydroquinone, which is what we put on it. It's a skin lightener. That's in your French fries and in your sandwich. And polysiloxane is used in all processed foods because, it comes prepared and frozen. And if you drop frozen watery things into hot grease, it's gonna spat back at you.
Right.
You could do anything with splat back to explode. Remember when people was frying turkeys? That was the craze.
Oh, Lord.
Because a couple of people burned their houses down by not defrosting their turkey before they put it in that hot grease. Well, they put the dipolysiloxane in the food to make sure that when they drop it in the hot grease, it doesn't explode or splat back. But you're eating. Dipolysiloxane actually is used in caulking. The caulking that goes around your windows.
Right.
It's used in caulking. And you're eating those chemicals every day and going there every day running that and then coming over to to HOV when you get what? Hypertension, diabetes and all this stuff. So you're killing yourself slowly. Yet we have something that's killing us right away, and you don't want to take something that can help us and keep us from dying right away, but you're eating this other stuff every day. And on my last church, I did a church prayer meeting, and I was a motivated speaker at the end. Of course, they wanted me to speak on COVID. And I end all of my, I should probably end all of them like that, but at least all my church health ministries that I do, I always end it with this. Noah, if Noah got on the ark with the perishables that we have in our grocery stores right now, by the time they landed to get out, because you remember they took, male and female of everything, they took plants and seeds and everything so they can what? Restart life when they get to where they're going when the flood is over. So if they went into our grocery stores, the storm is coming, we're going to load up on the seedless oranges, the seedless watermelon, right? The seedless cucumbers, the seedless grapes, and load up on all of that so we have food, right? Once they got to the new location, God blessed them, it's over, they landed again, and now we want to, what? Restart life. They'd have been dead in 6 months. Yep. Because there are no seeds. And you're going in your grocery stores every day. And I remember when I was a kid, I used to eat an orange, I would open it up, I would bite it in the middle and spit the seed out to eat the orange. Right. Somewhere between the time I was 13 and 25, they took the seeds out.
Navel oranges.
Mm-hmm. Right? Same thing with a watermelon. If you take those little pitted things in the seeds of watermelon and throw them out in your backyard, they ain't gonna grow nothing. No. But if you wait, like I do, till the country truck comes up from South Carolina, North Carolina, with the watermelons with the black seeds in them, that I've seen since I was a kid, we can take those seeds and plant and make our own watermelon patch. So, we are indulging in things that you're not researching, you're not afraid of, and you're indulging in every day on all of these chemicals, high fructose corn syrup. There's not one soda today that actually has sugar in it. It's all high fructose corn syrup.
Right. Which causes diabetes.
And high triglycerides.
Right.
And high triglycerides.
And weight gain.
And weight gain.
We went to Jamaica and we did an experiment. My wife here, diabetic, she had Jamaican soda, at least one every day the whole time we were in Jamaica. Blood sugar never went up over 150, 160. It shouldn't have gone up, but I'm just saying. But we came back and tried the same thing with American sodas, and she was over 200 within 2 days.
Right.
A week on their soda, because they make sodas back in there like they were originally made with pure cane sugar.
Right, exactly.
It's still sugar, but I'm just saying, you see what the difference is. It
comes from the ground, it's not chemical.
Exactly.
Right. Listen, I want you all to know something. I want you to know who these people are, because they done thrown out a whole bunch of fancy chemical names. They're pharmacists, but they're specialty pharmacists, okay? And she mentions things about zinc, and you heard her say the word, I take my supplements. What you don't understand is this is what they do. They have a specialty pharmacy where they're compounding specialty drugs that doctors prescribe that you can't just get from a pharmaceutical company, right? They don't sell them over the counter. They have to compound and make these special products. So these are basically experts on what boosts the immune system, what supplements to take. You heard her mention zinc, but she's just not taking any zinc. She's taking a formulation that she's looked at every piece of that formulation and knows that the stuff is pure, that it works. They have studies which have shown that it works. So I want you all, as we close, to tell them about the name of your pharmacy again, right? Where it's located, because they can actually make phone calls. You ship, right, all over the United States. So you mentioned alopecia. You have a whole lot of things that you're helping with your compounds. And so I wanted you to do that so that they just have a resource, right?
Actually have some samples.
Oh, she actually has some samples. I tell you what, we're going to put it up on the website,
Okay.
So we're gonna make sure that this episode's up there, and we will, at the end of this, once we close out, I wanna have you do a special commercial
We have
showing
two
your
things.
supplements.
Yes,
Well,
ma'am.
it'll be up there, guys. So look on the website. We're gonna have this special thing, Quality of Life Pharmacy. We'll do that as a supplement, right? Is that good? So you can take some time to talk about that. I love that. But just tell them a little bit where you are, how they get you, what your website is, so that they know how to do.
Okay, the
to
name
get in
of our
touch.
pharmacy, Quality of Life Pharmacy and Health Incorporated. We are located at 8900 Edgeworth Drive, Unit G in Capitol Heights, Maryland. We have been in business now for what, 15 years? 15 years.
Sure.
We do medication, what's called MTM. So we do medication reviews with our patients. We do saliva testing, and we work with your doctor who does your blood work and your analysis. And we look at that and the results of your saliva test, and we put together care plans to address any deficiencies that we may notice that may come up during your testing. And so our goal is, and this is the problem in our community, we don't focus enough on prevention. We wait till we get the disease and then we call on Jesus, when he already has given us all the tools to prevent the disease. And so that was why we created Quality of Life Pharmacy in the first place, because we wanted to start educating our community about what you can do to prevent disease, not to treat it, but to prevent. If you get the disease and you come in, we'll work with you to hopefully get you off of some of these medications through lifestyle changes, nutrition changes, finding again the deficiencies, because a lot of the drugs you're taking are nutrient depleters. So you need to understand that. And we do a lot of education. I mentioned adrenal fatigue. We look at your adrenal function through saliva. We actually do saliva testing because just like AIDS, they swab your saliva and they look at and they test it for that virus, and they test for the COVID virus using nasal secretions. Well, guess what? We can look at hormones. We can look at insulin. We can look at your sex hormones. We can look at for food sensitivities, all through saliva testing, because that's what's going on in your tissue. So that's what we do.
Yeah.
That's what we do.
A phone number.
Oh, our phone number is 301-324-3715. We can do Zoom consultations if you're interested. And we're very excited. And our partner here, Dr. Lenore Coleman, with diabetes, we're very passionate about ending the struggle with hypertension and diabetes. And that's why we're working together as a team to get this done.
Yep.
Let me explain to you the name. You know, with our people in our community, you know, we tell you what we're about, and we tell you what we're about in the name. Healing Our Village, right? She's telling us right off the bat where her goal is, starting out the bat. Well, our quality of life came from the fact that being in the field for 10 or 15, 20 years, and especially being on the hospital side, we've seen what happens once you get to that point. Once you get to the point for surgery, once you get to the point where you're on 10 medications, 12 medications to try to control all your functions. I have sat there in the hospital and reviewed inpatient admissions, and the doctors have to write a pill for you to go to the bathroom, a pill for you to stop going to the bathroom, a pill for you to go to sleep, stay asleep, wake up, pain, everything, blood pressure, thyroid pressure. So what we looked at was, how can we go back to our community and improve the quality of our community's life?
Right.
By what can we do to keep you from getting to the point where you end up on 10 medications and you end up in the hospital? I mean, we have had people call us anti-pharmacists, but we took an oath to help you with your health.
Right.
That doesn't mean that we just say, hey, we're just going to dispense the medication and you stay on them until you die. Because there's an opportunity through lab work, through testing, through dietary changes, doing weight loss, doing supplements, for us to help you and your doctor. We're in the triad between you and your doctor to try to get better control of your health and improve the quality of your life.
Yeah.
And that's what we came with today.
So you got three serious folks here today, people. We are walking the walk and we are talking the talk. We're serious about it. We get up every day, brush our teeth, put our clothes on, and go out here to try to change the lives of the people that look like us and around the world, trying to do that. So please, use us as your resources. Again, Healing Our Village is 800-788-0941. My website is HOVHealth.com. If you liked this episode, it'll be posted up on the website, posted up on my YouTube channel, which is Healing Our Village Official. All right, so the link is going to be up there. Push it out to your family and your friends, people. This was a COVID conversation. We do this whenever I am honored to have special people in the house that can give you real information. So I hope that today we have convinced you today to go, please, today, go get your vaccine. Just Coleman needs that to happen, please.
Website.
Okay? The website is HOVHealth.com. And you want to give your website?
Is QOLRX.com.
There we go. QOLRX.com. All right, guys. Thanks so much for joining today. Look for the next notification for Your Health COVID conversations, and we'll be back at you. This medical moment is brought to you by Total Lifestyle Change. Should I get the COVID-19 vaccine? The answer is yes, you should. Over 600,000 people in the United States have died of COVID-19 since 2020. This is not a myth. This number is for real. If you're an African American with diabetes, heart disease, obesity, or other conditions that affect the immune system, you're at a much greater risk of suffering the bad effects of COVID-19. The Delta variant is here in Georgia. Only 38% of the people in Georgia have been vaccinated. This needs to be 80%. The Delta variant is more contagious. Most of the hospitalizations we're seeing now are in unvaccinated people. You're in control of your destiny. You can protect your family and friends by getting the vaccine. For more information on where to get your free vaccination, go to vaccines.gov. If you have any questions about the safety of the vaccine, call Total Lifestyle Change at 800-788-0941. This medical moment has been brought to you by Total Lifestyle Change. For more information about COVID-19 and other chronic conditions, visit us at tlc-global.org. Remember, knowledge is power.